My name is Emma Kumper, and this is my head, ears, eyes, neck, and mouth assessment video. And Mr. Filey has verified that there's no notes in the room. So thank you, and we'll continue. First, I would have checked my chart to make sure what the patient needs and who she is. Then I would have come in, knocked at the door, and provided for privacy, and washed my hands. And then I would introduce myself. Hello, my name is Emma, and I'm going to be your nurse today. Can I ask you your name and birth date?
Yeah, my name is Cassie Karpovich, and my birthday is February 13th, 1997.
So those are two identifiers. And do you know what city you're in?
Yep, I'm in Flint.
Are you here for a physical checkup?
Yep.
Okay, so she's alert and oriented times 3. Her mood and affect seem appropriate. Okay. So then we'll get started. Are you in any pain right now?
Nope.
Have you had any headaches or dizziness?
No.
Okay. So then I'm going to palpate her scalp to check for any lesions or nodules. And okay. Her head was free of lesions or nodules, and it is round, normal cephalic, and atraumatic. Her hair is evenly distributed. It is clean, dry, no lice, and no dandruff. Okay. And then I'm going to have you close your eyes, and I'm going to assess cranial nerve number 5. Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull? Sharp or dull?
Dull.
Cranial nerve number 5 is intact. The skin on her face seems clear. Her head is round. There's no abnormalities. The color is pink and regular, normal. Okay. Then we're going to assess her eyes. Her eyebrows and eyelashes are both evenly distributed in the appropriate color. Okay. Her eyes are both round, and her pupils right now are at about a 4. Then we're going to assess for Perla. Okay. And then we can do the 6 cardinal gazes. Just follow the pen light. All right, good. So cranial nerves number 3, 4, and 6 are intact. And then we would do the Jaeger test to assess for cranial nerve number 2, and the Snellen test to assess for vision. But cranial nerve number 2 is intact. Okay, and now I'll assess for the sclera and the conjunctiva of her eyes. Her sclera is white and appropriate. Her conjunctiva is moist and pink. There's no nodules, lesions, or redness. Have you had any trouble with your vision?
No.
No. Do you wear contacts or glasses?
No.
Has anything become blurry lately?
No.
Can you read things far away and up close?
Mm-hmm.
Her ears are equal on each side of her face and in line with the top of her eyes. And now I'm going to ask for tenderness on the mastoid process. Any tenderness?
Nope.
Tenderness? Check your ear for drainage. Okay, there's no drainage, lesions, tenderness. Her ears are even, and there's no tender. I already said no tenderness. And they're appropriately colored. Okay, her nose is centered in her face. Oh, have you had trouble hearing anything?
No.
No. Do people have to speak louder to you? Is there any ringing in your ears?
No.
If you could turn and sit on the edge of the bed, we'll do the whisper test. Okay.
Curtain.
Yep. And
Blue.
both were correct. So cranial nerve number 8 is intact. I'm going to assess for the temporal mandibular joint. Okay. That is intact. So that is part of cranial nerve number 5. And then for the nose, it's even on both sides. It's aligned, it's straight, and then I'm going to just check for a deviated septum. There is no deviated septum or perfused septum. There's no drainage. The nasal hairs are intact. It was pink and dry. Have you had any problems smelling anything lately? Okay. Her nares are equal and rounded, and she reports that she can smell everything. So, cranial nerve number 1 is intact. Then for her mouth, her lips are pink and dry. You open your mouth. Say ah.
Ah.
Okay. Her uvula was intact, the soft palate was intact, the hard palate was intact. Her tonsils were about a 1. Oral mucosa is pink and moist. No signs of gingivitis. All teeth are intact. Can you stick your tongue out? Up and down, then side to side. Then you say light, tight dynamite.
Light, tight, dynamite.
That means cranial nerves number 9, 10, and 12 are intact. Okay. And now I'm going to assess the neck. Her neck seems to be even on both sides. And we're going to assess for jugular vein distension by laying her. Well, we would lay her all the way flat. Oh, no, never mind, we got it. And then raise her up to about a 45-degree angle. And there is no jugular vein distension. Have you had any tenderness in your neck?
No.
Have you had any tenderness in your mouth? No sores, no lesions?
Nope.
No problem swallowing?
Nope.
Okay, no dry mouth?
No.
Irritability? What about sore throat?
Nope.
Okay. And then I would check for her carotid pulses on each side separately. Right. And now I'm going to listen for bruits using the bell of the diaphragm, or the bell of the stethoscope. No bruit is present and they're equal bilaterally. And I forgot to check her temporal pulses, so they are also present and equal bilaterally. And then I'm going to check for the lymph nodes on either side. The pre-auricular, the post-auricular, the cervical, the jugulo-digastric, and then her clavicular and posterior cervical and superior cervical and the deep cervical chain. Okay, none are palpable, so that's a good thing. Can you turn your head to each side? All right. Can you push up on my hands? Okay. So cranial nerve number 11 is intact. Okay, and now I'm going to check for her thyroid gland. Yeah, we actually do that, right? Yeah, okay. Can I have you sit up and turn to the side of the bed? Okay, can you push your head forward and down to the right? And now by moving the sternocleidomastoid with my right hand and pushing it over, I can feel that there's no thyroid distension. It's not enlarged. And then can I feel your trachea? Okay, your trachea is midline. Is there any soreness in your neck?
Nope.
Was any of that tender?
Mm-mm.
No? Okay. Do you have any problems moving your head side to side or up and down?
Nope.
Okay. Now, if I could ask you, I'm going to check your capillary refill. Right? I'm going to just, there we go. All right. Okay. You can turn back. Capillary refills were all within 3 seconds. Brisk. Okay. Can I have you put your hands like that and like that? Okay, so to assess for range of motion, I'm going to ask her to move her hand between my hand and her nose as quick as she can. Move back and forth. Okay, other side. Okay. Then for her legs, can you bend both knees? All right, can you put them straight? And then can you push back down against my hands? Okay, and then pull back up. All right. So all range of motion seems good. Can I have you stand up and walk with me?
Yeah.
Okay. All right. We can go back. Her gait is even and steady. And can I have you bend down and touch your toes? All Alright, her spine is in alignment. It doesn't seem to be shifted to either side, no bends or curves. And besides tattoos, her skin is clear, is pink. Sorry. Sorry. It's pink, clear, no protruding veins. She's not cyanotic. Okay. Well, thank you very much. That's it.